Hello, good evening. Dr. Chudi of Snowspirations Global Health Solutions. This evening is also a very wonderful day. Today is the 21st of February 2023, and every 21st February is a very big day in my family. Today is my daughter's birthday, so I'm pretty much thankful to God for all the blessings. But today we're going to talk about sleep, the impact of sleep on our fertility, especially regarding pregnancy. Can sleep affect how early or how later you can become pregnant? Is there any role sleep can play in your ability to bring forth your own, both for the males and for the females? So, huge topic of great importance. And I want you to just quickly join and introduce yourself. And as soon as we have a good number, we're going to start. So I'm going to spend the first part of my presentation. Then afterwards, you'll have opportunity to ask your questions. If today is the first day attending my clinic, thank you so much. We appreciate you. Make it a point of duty to subscribe. So click on the subscription button. Make sure you set your notifications. We normally come live every Tuesdays by this time, 6:30 p.m. Eastern Time. Then on Saturdays, 12 p.m. Eastern Time. So thank you so much. And without wasting much time, let's start because we have a lot of important things to discuss. So you see, just like we've all known that some aspects of our life will be affected by our lifestyle, especially our fertility. So there are a couple of things you do every day that will actually delay you from becoming pregnant. So things like being underweight, being overweight, not following good diet, smoking, drinking, not engaging in physical activity, and overall poor health, they will not help you to become pregnant faster. But the bigger question this evening is there any role of sleep in becoming pregnant? And the answer is yes. Matter of fact, in America, there's a current study CDC conducted, and they discovered that 1/3 of all Americans have insomnia. Insomnia is simply sleep problems. Now, when you allow these sleep problems to become chronic, so over time, when you expose yourself to a lot of stress in your life, when you expose yourself to a lot of anxiety, over time, the chronic stress will begin to damage things in your body. So ongoing lack of sleep can actually impact your physical health, your mental health, your psychological health. And I'm going to give us a couple of things that will happen to you when you don't sleep. You will have problems with your short-term and long-term memory. So there are a couple of things you will begin to forget. You will have problems with concentration. Your concentration is not there. It's all over the place. Then you will be moody. So if you notice, the days you don't sleep well, when you wake up the following day, you're not just yourself. You're very irritable. You're very moody. And medically, when you don't sleep properly, you are increasing the possibility of developing blood pressure, high blood pressure. And you also increase the likelihood of developing diabetes and also heart diseases. And over time, you notice you add a lot of body weight. And it will also affect your ability to balance and coordinate a lot of things in life. But directly, sleep can also affect your fertility, both for the males and the females. We discovered that males and females that have sleep problems have problems becoming pregnant. Even few nights of no sleep can upset your whole balance. Now, we discovered that the part of brain that controls the reproductive hormones. So there are two important reproductive hormones that pretty much play a role in the ability of a woman to go through her cycle, release her eggs, and all that. They are called the gonadotropins. Two examples of the gonadotropins, the FSH and the LH. We discovered that the part of the brain that controls your sleep and wakefulness state is also the part of brain that controls the gonadotropin. So anytime you are deprived of your sleep. Cortisol and melatonin, these are two important hormones that regulate your sleep and wakeful pattern. Your hormones that will enable you to ovulate will also be affected. So the hormones that also trigger the sperm to get matured will also be affected when you're not sleeping properly. So in women who are sleep deprived, we discover they will likely have hormonal imbalance. And when they have hormonal imbalance, estrogen is not going to be normal, progesterone is not going to be normal, FSH is not going to be normal, prolactin is not going to be normal, and ultimately, you begin to have menstrual disorders. You begin to have irregularities. When you begin to have irregularities and we don't regulate that, pregnancy will be difficult to achieve. So over time, you discover that the inability to become pregnant can actually emanate from your poor sleep. And when you expose yourself to poor sleep, you can actually gain a lot of weight. Your blood pressure can go up. Your bad lipid can go up. And ultimately, when all these things combine together, they can lead to obesity. Obesity can lead to infertility. So when you expose yourself to a lot of stressors, a lot of anxiety in your immediate life, they can form a vicious cycle. So if you can't sleep because of stress and anxiety in your life, including believing God to become a mother, believing God to become a mother and you're not becoming a mother can be a source of stress, can be a source of anxiety. So there are so many women that are not sleeping in the night because they are so anxious, because they are so worried, because they have a lot of stressors in their body. So when they go to bed, they don't sleep and they end up crying or they end up feeling bad. And when you see yourself in that situation, what you do next is look for comfort. Most people will go to food for comfort. So over time, the lack of sleep will further make your stress level worse, will further make your anxiety level worse. And when that happens, you begin to have problems. Now, how much sleep do you need? This is a big question. Now, we don't want you to have more than 9 hours, and we don't want you to have less than 6 hours. So the general rule of thumb is to aim for 7 to 8 hours of sleep. So don't go above 9 hours. When you go above 9 hours, you can actually begin to have problems. So less than 9 hours, then more than 6 hours. And if we take that calculation, then we are having a neighborhood of 7 to 8 hours every day. That is what is recommended. We don't want you to sleep more than 9 hours. When you begin to sleep more than 9 hours, we discover that your fertility can also be reduced. When you sleep less than 7 hours, we also discover that your fertility will be reduced. So aim for 7 to 8 hours. So approximately 7.5 if you go in the middle. It works. Please go home and try this. Now, it's important to follow this because these are the natural things you can do for yourself. If you notice, I've not told you to take any drugs. So if you can control your sleep and wakefulness pattern, your hormones are going to be okay. Your stress hormones are going to be reduced. Your anxiety level will be low. You will remember to play your civic duty, including the lovemaking aspect. Couples that are not sleeping properly will be very irritable. Their libido will be low. They will not remember to practice PPP. So over time, they all add up. So aim to sleep better, including when you're going through IVF. IVF is an example of assisted reproductive technique. We discovered that women that sleep at least up to 7 hours and not more than 9 hours, they tend to have better results. So don't oversleep and don't undersleep. Aim for 7 to 8 hours. Now, what are the few things you can do to actually get the better aspect of your sleep? Make sure you get aerobic exercises every day, at least 30 minutes. If you can put in 30 minutes of exercise that can elevate your heart rate temporarily, you are putting your body in a good mood. So even if it's a simple walk for 30 minutes, it will improve your sleep. Have a consistent bedtime. Have a stipulated time you go to bed. So say 10, you're in bed, you're done. 9, you're done. 8, you're done. So find the time that works for you, especially if you are believing God to become a mother. Going to bed early one night and staying up very late the other night can confuse your body, can confuse your biological clock. Your hormones are going to be confused. So if you stick to a particular routine, your hormones will adapt to that. So strive to go to bed and wake up about the same time. Your body is already programmed. Like my body, no matter when I sleep, once it's 5:15, I'm up. So that's already programmed in my body. So I'm encouraging you to have a specific time you go to bed and a specific time you wake up. Set the stage for comfortable sleep. Make sure your bedroom is dark and cool. Some people put a lot of electronics, they put TV, they put music, they put light all over the place, and they are pretending to be asleep. How can you sleep when your TV is on? How can you sleep when your music is very loud? How can you sleep when the whole room is light? You dim your room, you make sure it's comfortable enough, not too cold, not too hot, shower and sleep. Make sure you have a strict no screen rule for 30 minutes before sleep. So before you go to bed, switch off all your electronic devices 30 minutes ahead of time. Put them away. Now, when you are about to sleep, learn to unwind, learn to relax, take a bath, sip a tea, read a book, listen to some relaxing music, then gradually lapse into music. Gradually lapse into sleep. Sleep, it's a learned thing. Practice this and you will notice a difference. Now, please, before you go to bed, limit your alcohol and caffeine or stop them immediately 7 hours before sleep time. No caffeine, no alcohol, 7 hours ahead of time. That's a lot of time for you to do the right thing. So healthy habits over time will help you. A restful, rejuvenating night sleep can go a long way to improve the quality of your life, including your fertility. The role of sleep in fertility is well established. Make sure you and your partner get enough sleep. Make sure you and your partner adopt healthy lifestyle. Eat properly. Drink a lot of water. Don't smoke. Exercise. Sleep. If you can practice all this, you will get there before you blink. This is my presentation this evening. At this juncture, I'm going to open the clinic and I'll allow you to ask your questions. So go ahead and ask your questions. I'll provide you feedbacks. And I'm going to run another clinic in Facebook immediately after this. So please ask your questions. Feel free. I'll provide you feedbacks before we head to Facebook. Okay? Do you have any questions? I think it's only one person that attended the clinic today, which is okay. That's all right. If this one person is helped and educated, that's a huge success. So please ask your questions. I'm going to give you 1 minute to do that. Okay, it looks like the person is also okay, not forthcoming, and that's all right. Remember the big event coming up on Sunday, our mega masterclass on multiple pregnancy. If you haven't registered, I encourage you to go and register immediately so we can meet you halfway. So register for that event. Remember, if you live in Nigeria, you can get a package. You can get 1 week, you can get 1 month, you can get 3 months, you can get 6 months. And if you're already pregnant, you can also get ANC package. Leverage on the advantages of being a member of this group and make sure you show up every day. And remember, if everything else fails, PPP will always be there. So pray to God, play, and practice. And thank you so much. And I'll see you guys. My next clinic will be on Saturday by the grace of God. So I'll see you guys on Saturday. Until I see you, God bless you and enjoy the rest of your evening. Bye-bye for now.